to push things forward. Here's an example.
I'm Francoise Marble. I'm a cardiology fellow at Johns Hopkins.
Seth Martin, I'm also a cardiologist at Johns Hopkins.
Seth and I spend our days, 6 white coats hovering over a bed, and we're trying to actually share what the patient's condition is, how they need to improve their life. We use medical jargon, we speak quickly, we confuse patients, and they're left on their own. There has to be a better way than just treating a patient, handing them a bunch of papers, and expecting that they're going to understand how to change their life. We thought, well, what if we completely re-engineer the process for a heart attack patient by using Research Kit, Care Kit, Health Kit, and then connecting it with an Apple Watch so we can bring in key cardiovascular metrics that help us to know patients are doing well.
When Francoise was in the Technology Accelerator program at Hopkins, the work there led to this phone call with Apple. And towards the end of the phone call, Francoise said to Divya at Apple, what can we do to accelerate this? And Divya said,
you guys got to come out to Cupertino. Let's turn your vision into reality.
And we had a Silicon Valley Airbnb, and we started side by side coding with our iOS developers. And then every couple hours,
we would talk about their vision and the tools they could leverage.
We'd go to a whiteboard and we'd lay out,
here are the things you guys should go tackle.
And we go back to our Airbnb, pour more coffee, order some bubble teas, eat some food. And then we would go into Cupertino.
They'd come back into Cupertino piled in a minivan
and spend almost a full day there getting more feedback, working with their teams. And then
they would leave our offices and work through the night building and implementing the things we had talked about. With our tools and their vision, we ultimately made magic together.
We left Cupertino invigorated, and guess what? Our clinical trial was able to save an incredible amount of people from having complications and come back to the hospital, and it reduced hospital readmissions by 52% and likely saved a lot of lives.
I remember we were just sitting outside, beautiful Cupertino weather, and it was just one of those moments where it dawned on us that Corey app was going to have an impact on so many people's hearts around the world.
This is the start of something incredible. It's the spark, and now let's light the fire.
This is just one of the many inspiring stories out there and is a testament to and understand those changes. And here's Aditi to tell you about the first of these features. You can already view lab results like your cholesterol right in the Health app. In the US alone, 14 billion clinical laboratory tests are performed each year. That is a lot of information to keep track of. When you see your own results come in, it can be hard to understand what these tests mean or what has changed. The Health app will now include detailed descriptions to help you better understand your lab data. For example, when you receive a cholesterol result, you can now see that the LDL is a bad cholesterol, and having too much may put you at risk for heart disease. You can also now see whether your labs are within expected ranges. Together, these views will help you get even more meaning from your lab results. Many health changes happen over time, so to better understand your health even more holistically, we're introducing Trends. You'll get insight on long-term changes across areas such as steps, resting heart rate, blood glucose, sleep, and much more. You'll also be alerted when there's a new trend in your data, which may be something you want to monitor more closely or even discuss with your physician. Care about. It's the health of our family and loved ones too, whether they live with us or far away. For some of us, that means taking care of our kids, and for others, it's our aging parents. And for many of us, it's actually taking care of both, generations above and below.